My name is Mohamed Mabrouk, and today I will be presenting my project about an integrated care for managing the Parkinson disease in elderly patients. My supervisor is Dr. Maqbal, and our case is presented from Asfendiyarov Kazakh National Medical University. First off, to start pretty off about the prevalence of the Parkinson disease, as it has significant numbers in worldwide 5.8 million cases presented. In Kazakhstan, it's 204,000 cases right now, but it's expected to be much more than that in the upcoming years. Speaking about Parkinson disease, as everyone knows, it's a neurodegenerative disease, which combination of factors play a role in it. The case that we have describes the clinical course and the management and the outcomes of a 60-year-old patient with advanced Parkinson disease, specifically a third degree of Parkinson disease. She presented with comorbidities and an akinetic rigid form of tremors. With the high prevalence of this disease worldwide, the unknown mechanism of its onset, it presents a challenge to nowadays neurologists in clinic. Speaking about materials and methods, we have a 60-year-old woman presenting with stage 3 Parkinson disease. She has also the akinetic tremor form, recurrent tremors happening, altered gait, dyskinesia, and muscle stiffness. Our treatment approach, we had to use a stereotactic thalatomy, stereotactic pallidotomy, which was performed twice, and pharmacological interventions, of course, levodopa, carbidopa, with a reablation program. Our assessment tools we used the motor function we used for the motor function and quality of life was assessed, of course, using the Barthel and mini mental state examination scores. About our outcome, the comparison of the motor functions before and after the intervention, and of course the reablation program. First of all, our timeline. The case came in 2022 with a tremor, slowness of movement, and difficulty walking. We performed a stereotactic thalatomy on the right side at that time for symptom control. For pallidotomy was performed once at that day on 2022, and also we had a pallidotomy that will be performed later on. A pharmacological treatment started also using the levodopa, carbidopa. On 2022 July, we had an improvement in the emotional stability, speech, and sleep. We discharged the patients with an improvement in the Barthel score from 70 to 80. On 2023, the left side tremor decreased and regressed a lot. And then we had the scheduled pallidotomy performed for the second time. On 2023 of October, the dynamics of these patients were observed, and they were extraordinary, let's say. The increase in Barthel and MMSE score index were changed and were seen. In 2024, we found that the Barthel index was 85, which is amazing. MMSE was to 28 when the patient was presenting. It was presenting with 20 only. And the Hamilton scale indicated a moderate residual symptoms of 26 points. For the interventions that we use, the thalatomy, first of all, it has steps. Of course, there will be a burhal cariation, which is like a small incision, just like it's drilled into the skull, into the right hemisphere, of course. And then we have an electrode which will be inserted inside the burhole and advanced will have a calculated coordinates of the right VIM nucleus. For our intraoperative testing, the surgeon stimulates the targeted area while assessing the symptom improvement. And of course, we have to ensure there is no side effects such as speed or motor deficits. For the lesion creation, once we confirm this target, the electrode delivers like a certain radio frequency energy, which creates a small lesion in the right VIM nucleus to disrupt abnormal neural circuits that will be causing these symptoms of Parkinson's disease. For the pallidotomy, it was the same. We had a small skull opening, the electrode was placed, and there is an intraoperative mapping of the certain coordinates, and then we have to make the lesion. But the lesion here will be to destroy a small portion of the corpus pallideus. And here we can see the patients by video, the way how the patient improved. If we see here in the first video, in the form of movement, she can move without a lot of tremors. If we see also about the hand movement here, we see that she can move the hand movement very fast, also on orders. Moving on to the next slide, and this is how an MRI looks after doing a thalatomy. You can see that here's the internal capsule and the thalamus and the ventricle of the brain. We can see here that after the treatment, we find a left-sided focused ultrasound lesion here. This lesion that we spoke about that will happen after the thalatomy. Our results show the significant improvement of this patient. In the Bartle scores, for example, it improved from 70 to 85. The tremor was reduced significantly. The improvements in gait. The cognitive function, according to MSE score, was also observed as discharge. The patient's treatment also regime, which contains pharmacological treatments and a special rehabilitation program of physical therapy, for example, Tai Chi, voice changes, and also a strict diet of Mediterranean diet also for the patient to improve, also contributed a lot to this patient's becoming better. Our conclusion that this case illustrates the complexity of this Parkinson disease. The surgical intervention provided a temporary relief, but the long-term management of a rehabilitation program plus pharmacological treatment is very important, and lifestyle adjustments. The positive results of this case highlights the need for personalized approaches to optimize the outcomes of the patients with Parkinson's disease. And thank you, everyone.